to turn around. I know God will work it out. God will work it out. One thing I know, one thing I found, God will work it out. Oh, yes, He will. Oh, things are coming together.
Pushing past the fear, fighting to believe He is making ways for me. And He won't let me down, never ever leave. He's still making ways for me. And when my heart is full of doubt, it feels like faith is running out. I've come too far to turn back now. I know God will work it out. God will work it out. One thing I know, one thing I found, God will work it out. God will
He's working right now. 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 I know it, I know it. He's working right now. I believe His word. God is working now. God is working now. One thing I know, one thing I found. Oh, God is working. Come on, just sing it one more time. Sing it out. God is working now. God is working now. One thing I know, one thing I found. My God is working now. One thing I know, one thing I found. God is working now.
All right, good night, everyone, and welcome back. Let us go ahead and record this. Of course, you know how it is. There we go. Welcome back to another of our Sunday night health brought to you from the Evesham SDA Church. We are about to jump into this thing. I know persons are still jumping on. We have persons on YouTube, and we have you guys here on Zoom. Don't forget to share the link out, bring in your friends on. We have a lot of powerful information to share tonight, and we are not going to waste too much time with the preliminaries. We're just going to get the footwork started, and then we're going to jump right into this thing. So, as you guys know, the topic for tonight is what's going on with my body. What's going on with my body? And we will have a special guest, Dr. Dian, coming in all the way from Trinidad. Now, of course, we start every webinar the same way. Disclaimer: this webinar is for educational purposes only and is not intended to replace medical advice. Please consult your healthcare provider before making any changes to your health. And we're going to start this off with prayer. Of course, we must invite the Lord's presence in here tonight because, as I said, guys, I know there's a lot of powerful information for you guys. So just bow your heads with me at this moment. Let us invite the presence of the Lord. Dear Father in heaven, we want to thank you, Lord, for the opportunity to be here tonight. We want to thank you, Lord, for this platform. We want to thank you, Lord, for keeping it alive. We want to thank you for the work that you have been doing through this for the last few months. I want to thank you especially, Lord, for clearing Doc's schedule so she can be here with us, Lord, tonight. We ask, Lord, that as she speaks, that your Holy Spirit may imbue her with the wisdom, touch her tongue, and we ask, Lord, that everything will be done to the glory and admonition of your name. As we continue now, Lord, we ask that you may take control, we pray, in Jesus' name. Amen. All right. So welcome one, welcome all. Do me a favor, guys. Let me know in the chat where you are signing in from so that we can give you guys a shout out. You know, we always like to shout out our audience. Special welcome to our members from the Evesham SDA Church. Special welcome to our Fitmas. We see you on here. And we have a lot of persons joining in, coming in. And we are about to kick this thing off. So let me do a brief, actually, let me see the chat here. So we see Trinidad, St. Vincent, lovely. All right, the numbers are coming in. Lovely. Now, I don't want to take up too much of Dr. Dian's time. Let me give you guys a layout of the session for tonight. So we are going to pass it over to Dr. Dian shortly, but she has even agreed to open up for a short Q&A session for us. So I'm going to hand the mic over to her pretty shortly. Now, Dr. Dian is an experienced physician with over 16 years in the medical field. Now, she's a graduate of the St. George's University School of Medicine, the beautiful Spice Island of Grenada, and she actually completed her clinical training in Norfolk and Norwich Teaching Hospital in the UK. After serving at the Eric Williams Medical Sciences Complex, Dr. Mitchell established her own private practice in Sawa in 2015. Over the years, her approach has progressively shifted towards holistic well-being with a strong focus on women's health. Now, you see where we have her on here tonight. Beyond her clinic, she extends her dedication to health and wellness to active involvement in community outreach initiatives and care for the elderly. And I've personally met Dr. Dian through a very good business partner of mine. That's how I was first introduced to Dr. Dian. And the first time we spoke, I could see that Dr. Dian was a lady who was caring about people. Now, if you are around her, her energy is infectious and she has a wealth of knowledge. And one thing I admire about her, she's very humble. She is very humble, even with such a collade of experiences and qualifications. She's a very humble woman. So that being said, allow me to introduce. I want you guys to put your chats, your claps, your clapping hands in the chat and help me to welcome Dr. Dian. Dr. Dian, the floor is yours.
Good night, everyone. It's a pleasure to be here. I have a little presentation, so I don't know if you want to
So
allow
let
me
me
to
hand you over the admin. I'm going to
screen.
hand it over to
Yeah.
you and you'll be able to do all you need to do. Let's go. There you go. It is now yours. So guys, while we're waiting, don't forget to share the link out. Bring all your friends, bring all your family members. Every woman you have in your contact, you should be bringing them onto this chat.
Right. Can we see that?
Yes, we are seeing you on the screen.
Good. So I'm trying to figure out how to see my notes. But okay, so if I'm a little distracted, just because I'm not seeing my notes on my presentation, so if I'm looking away, don't worry about it. But anyway, let's begin. It is a pleasure to be here tonight and share with everybody who's here today. And the presentation that we have was really a question. And if you notice on the little flyer we did, we talked, the question is what's happening to my body? The question is understanding women's health. And I decided I was going to change the name of the presentation. And you'll see on my screen there, on that PowerPoint, the answer to the question. The answer is we are fearfully and wonderfully made, so we are fearfully and wonderfully well. And really and truly, I think it's all about navigating every stage of life. And the purpose of my presentation tonight really isn't so much to give you a whole lot of information, and it's really more to lay the foundation for every other discussion we're going to have in the future about women's health. I think health is a concept we have to think about in layers. You know, I remember a nice analogy I always think of is, and it was from one of the pastors that I listened to, Joseph Prince. And he said that he was with his daughter and it started to rain. And he said to his daughter, you know, the word of God is like the rain, the raindrops. And we get these bits of knowledge and wisdom in these drops, and God gives it to us. And you'd ask yourself, well, why don't we get it all at once? But imagine if God gave us all the rain all at once. Instead of the rain helping things grow and the water cycle and everything running smoothly, if all the rain came at once, we'd be overwhelmed. It will cause chaos and destruction. And I think knowledge and wisdom is always like that. It's layers that we add bit by bit as we go through different stages of life, as we meet different people in life, as we learn different things in life. We add to the layers, we add to our knowledge, we add to our wisdom, and that's how we get better and better every single time. If we try to get too much knowledge too quickly, instead of being able to process it, what happens is that we get confused, we get chaos, and we actually end up taking information that wasn't really meant for us. We end up not being able to connect the dots, and we end up not being able to use or have the value of the information like we should if we had gotten it step by step, bit by bit, where we were able to consume it fully. So let's just start with that. And what I've done in this first slide here is just lay out what I think is the 4 pillars of health. And of course, we could expand this and we could make a list of 10 pillars and whatever. But for today, for tonight, I've broken it down into 4 things we need to think about when we're talking about health. And yes, I'm specifically more going to focus on women's health, but of course, this applies to everybody. Number 1, fuel. And we're going to go into more detail and break some of these down a little bit later. We're talking about what we eat, because what we eat is going to shape us. What we eat becomes a part of us. And if we're not working on that, if we're not doing that with an approach of, being mindful, then we have a problem. We have movement, exercise, activity. We were born to move. We're made to move. Our body's built that way. So exercise and activity is important. We have rest, of course, sleep and recovery. And then we have resilience, right? The mental, the spiritual aspect, I think, of womanhood. So let's talk about, now, typically, I don't like analogies that are not, I want to say intrinsic to us, because we only have rainy season and dry season, right? But I love using the analogy of a woman's life as being different seasons. So, we have spring, we have autumn, we have winter, we have all these seasons, and each season can correspond to a different point in our life. And if we look at the springtime, we consider that the childbearing age, right? Those are the years where we are, everything that we have, what we're doing, we're great, we're happy, we're young, we're vibrant. And as women, we see certain things pop up at certain phases. All right. And during that young childbearing age, what are we seeing most of these days? What we're seeing is a lot of things like PCOS and thyroid. And why are we seeing that? And we're seeing that because at that age, it really is a balancing act. Our hormones, we've just gone through puberty. We've gone from being a young girl into being a woman. And there's a whole complex cycle that has to happen in order for us to move through that transition easily. So when that transition happens, it's very easy for things to go out of balance. And when hormones go out of balance, we end up with these issues. So right now, the most common thing we're seeing is PCOS. When I graduated from med school, PCOS was probably, it was infrequent. I would say probably 1 in 15 to 20 women. It wasn't very common. And now in my practice, I would say probably 1 in 3 or 1 in 4. It's that common now, I would say. That's something that's new. And that's something we could dig a little deeper into later on, because a lot of PCOS I think that we have now is not your typical PCOS. Because when we learned about PCOS, PCOS is really a disease of the obese person. It's a metabolic disease that happens because there's excess fat. The fat is producing hormones, and because the fat is producing hormones, your ovaries are producing hormones, you create a lot of imbalance. So you end up with these cysts that are not responding to the correct signals that they should be responding to. And so you develop PCOS. Now, if we know human anatomy, we know there are other organs that are also influencing the ovaries at any point in time. And namely, the thyroid is one of the big ones. And that's why oftentimes when you look at thyroid dysfunction, the most common group of women, of people, I should say, that get thyroid dysfunction would be women. And part of the reason is we have this complex cycle with lots of hormones that are interplaying one to the other. And that complex cycle is being controlled by the thyroid. So when it's out of balance, the thyroid gets stressed out. And when the thyroid gets stressed out, it goes into dysfunction, right? So PCOS is one of the common things that we see now. And like I was saying before, it's no longer an obese disease. Now we're seeing this skinny PCOS. And I think a lot of that now has to do with what I would like to call the toxicity diseases, right? So we have diseases that could be, let's say, deficiencies. We have chronic disease, of course, the non-communicable diseases. We have communicable diseases. And then now we have this new class of diseases that we have to call environmentally related or toxicity related diseases. And it has to do with a lot of these foreign chemicals that are circulating, the toxins in the food, the toxins in the air, the toxins in the water, chemicals that our body doesn't know how to handle. We have chemical disruptors, estrogen disruptors, endocrine disruptors. We know about BPA. BPA is one of the chemicals found in plastic bottles when they get heated. And they found BPA to be a big thyroid disruptor, also estrogen disruptor. So we have these chemicals now that can cause our body to go into a state of imbalance. We also even have food products. So for instance, there is a fungus that produces a mycotoxin called zearalenone, and that actually can mimic estrogen. So if I drew the chemical structure for you, you would see how similar the structure of this mycotoxin is to estrogen. And what that means is that this mycotoxin can actually bind to estrogen receptors. And when it does so, it has a higher affinity, and oftentimes it's not as easily reversible. So you find it binds to the receptor, it stays there, and it keeps overstimulating that receptor to a specific endpoint. And when that happens and you have this overstimulation, what happens? You develop cysts, you develop fibroids, you develop all these other issues. It could also explain why we're seeing a lot more precocious puberty. When I was growing up in my class, 11, 12, 13 was the average age of menses. So a young girl started to see her period around that time. And if I tell you now, I am seeing girls as young as 7. I would say 7, 8 is now the average age. And I know personally of young girls who started seeing their periods at 6. I mean, it's not as common, but I've seen that. And what that is telling us is that something is causing a shift. And instead of puberty, kicking in later when the estrogen production starts, it's telling us that the food, the toxins, etc., is kicking in puberty at a much, much earlier age. So we have to ask ourselves why. And it's because naturally we're supposed to kick in our own endogenous estrogen production at a specific time period. But if we're eating foods that are high in estrogen, we're going to fool our body into thinking, oh, it's time. Let's start estrogen production. And when we start that and that kicks in early, again, puberty kicks in earlier and a lot of these processes kick in earlier. So you find now, how does that impact women? Because imagine instead of going into puberty at age 13, 14, 15, if you have puberty starting at 6, 7, 8, what's going to happen to menopause? Remember, we're born with a finite number of eggs. So you have a lot of women who now end up in menopause in their 40s, 30s, 40s, and 50s. And oftentimes that could literally just be because puberty started earlier, there was a whole lot of hormonal disruption happening, and that created that long-term problem that we see later in life. So PCOS and thyroid issues, that's the big deal when we're looking at that childbearing age group. The other big thing in that childbearing age group is going to be pregnancy. Why? Because pregnancy is the next biggest shocking, I mean, I don't subscribe to, giving birth as beautiful as it is to being a purpose in life, but really our biology is adapted to pregnancy and giving birth. And sometimes when we don't understand what's happening to us, we have to think about why a certain process is happening in our body. And while a woman might say, well, look, I don't want to get pregnant right now, that doesn't negate the fact that the processes happening in her body are all geared towards a possible pregnancy. Okay? So a lot of the times when we experience certain things at certain points in our cycles and we're not sure what's happening, we have to ask, what phase in my cycle am I in? And why am I feeling these symptoms that I'm feeling? And then if you do get pregnant, I mean, pregnancy in itself, people get pregnant every day and they think it's simple. But when you understand the science and just the sheer statistics, and when you run those numbers, just the chance of a pregnancy is a 1 in a million, right? We take it for granted that, oh, you'll just get pregnant. But no, there's so many things that have to line up perfectly for a pregnancy to happen. And then the pregnancy itself, imagine just two cells forming this whole human being, all right? And that being is being incubated inside a body, totally inside, and even just from onset of pregnancy, 25% of a woman's blood gets shunted and sits around the uterus. Imagine that. That's like if you bled out a quarter of your blood. Imagine that. So you get pregnant, and a lot of times when women come and they're like, Doctor, she's only 2 or 3 weeks or 4 weeks pregnant and she's sick and she's tired and, she's not pregnant. She's not even showing yet. Why should she be feeling sick? That's why 25% of her blood is no longer in circulation. 25% of her blood is just sitting around that uterus to incubate that pregnancy. And so that in itself is a marvel. And it also kind of leads the discussion into something else that we could touch on, which is circulation. And a lot of the times we forget the female body and estrogen, I should say, estrogen has this very big impact on our circulation. As women, because we have that ability to get pregnant, you would find that estrogen can modulate our circulation very, very quickly, very, very rapidly. So at certain points in your cycle, you may have symptoms of issues with your circulation, and other times you're fine. Women are more prone to varicose veins. Women are more prone to spider veins. Why? Women are more prone to cellulite. Why? All of this is related to estrogen and the way estrogen is going to impact our circulation in our body. Remember, lymphatics are also connected to that, and cellulite is connected to lymphatics. So all of that together is what tends to happen as you get into that later half, So the 30s and the 40s, you'll start to see women start to complain of the circulation problems. They'll complain of the cellulite issues, the feet swelling, when they stand up too long, all these other issues. And that ties in quite nicely to estrogen, especially when there's estrogen imbalance. Estrogen plays a very big role in fluid retention. All right. And that's part of the way it modulates the circulation as well. So again, that's why you'd have a lot of women who would notice swelling in their feet, swelling in their hands, their face is quite puffy. And you don't really get those complaints from men. It's estrogen mediated. All right. Well, I'm saying estrogen, but let's say female hormone modulated, because estrogen and progesterone, sort of perform different functions at different points in time. And so therefore, how they balance each other out will determine how this is going to go. And so then you have delivery, you have this baby, and the studies are there, and the studies show it takes 2 to 3 years to recover nutritionally from a pregnancy. So any woman that is having children, like I said, less than 2 years apart, you're not fully recovered nutritionally. Now, physically, you might feel okay, but nutritionally, all your stores, minerals, all these other trace elements, you would have used up a lot of it, all right? Just with that pregnancy. And it will take 2 to 3 years to really rebuild those and replenish those stores. How many women are really focused on that after pregnancy? Not many. So then by the time menopause hits, especially for women that would have had multiple children during their childbearing years, they wonder, how come I'm getting chronic disease? How come I have this issue? How come I have that issue? Why do I now have osteoporosis? Why do I have this chronic disease or diabetes popping up? Nutritionally, you're depleted and you never took the time to replenish yourself after the pregnancy to sort of have an easy way through menopause. And you'll see some women go through menopause and they're quite fine. And those women, again, they're not lucky. They're the ones who, I guess, put in the work. They're the ones who nutritionally were okay. And so they didn't have that issue going into menopause. So for them, their bodies adapted to the change quite easily. And then I'm sure you know other women that struggle, right? But we'll get into menopause probably a little bit later. So again, I'm just touching on a lot of topics. I'm just speaking about it. But like I said, when we get into the question and answer, we could kind of hash out in more detail, any questions or where we want the discussion to go. And again, build on what we're going to talk about next time. So then we're talking about that change that happens when you're in that 40 to 60 age group. Again, we just talked about the estrogen, the fact that estrogen has receptors everywhere. It's one of my favorite things to tell people and see their eyes change because we have more estrogen receptors in our guts and in our brain than we do in our ovaries. If you think about every female issue, you think about puberty, you think about menopause, you think about pregnancy, you think about PMS, just normal cycles, all of them are associated with gut symptoms. All of them are associated with brain symptoms. I think all the women can agree you've had that day where you woke up and your brain just wasn't right. You just couldn't think straight. You just struggled to get through what you had to get through. And then there are days you wake up and you're just clicking. Everything is running smooth. That's not in your head. That's a real thing. And it's mediated a lot of the times by estrogen. And I like to think about it I read it in a book and I can't remember which book it was, but they talked about women having a bigger portion of the brain that deals with intuition. And that makes sense because, again, women get pregnant. We have to make this baby. This baby cannot communicate with us. But a mother has to intuitively know what's going on with this baby. I'm sure we've heard stories of mothers where a child got into an accident or something went wrong and the mother just knew something was happening and something was wrong. And it talks about that part of the brain where estrogen can act that gives women more intuition than men do. So we're more aware of other people's needs. We're more aware of what we need to do to take care of them or to make them better. And that has to do literally with estrogen and the ability of the estrogen to interact with certain receptors in our brain to give us that higher level of functioning that maybe we can't explain, but science has shown that there's something different there. Then we talk about estrogen and the guts. 2 reasons. One, estrogen itself can affect motility of the gut, estrogen and progesterone. And if it's doing that, it's going to affect the ability to absorb certain nutrients. When we're talking about gut health as well and estrogen, we also have to talk about what we call the estrobiome. And I'm sure we know about the microbiome. The microbiome is that ecosystem, that the bacteria and organisms, parasites, etc., that all live within our gut. And there's a specific portion of them that deals specifically in the metabolism of estrogen. Parasites, and you could do the research, there are parasites that can actually stimulate your body to make estrogen so that the parasites can use your estrogen to reproduce. That's science. They've documented that. they've shown that there are other bacteria that can actually activate and deactivate estrogen in the gut. So you have this recycling of estrogen that can happen if you have the wrong microbiome ecosystem in your bowel, where you, instead of eliminating excess estrogen, you are recycling estrogen. Okay, so big link there with estrogen and the gut. And again, this is going to link us right back to things like PCOS. Could that explain estrogen dominance that we see? Yes, it possibly can. Could it explain why some women have fibroids and no matter how they do surgery, no matter how they eat right and do what they need to do, they still can't get on top of the fibroids. They keep coming back, coming back. It has to do with the environment. And again, if these bacteria, if the gut system is creating estrogen dominance, you can't necessarily get rid of that in one go. All right. So what you're having now is an environment where you create this estrogen dominance, and this estrogen dominance is what feeds the cysts and what feeds the fibroids, right? So remember that. So big thing there. And then we talked about the estrogen and the blood vessels. Estrogen affects cholesterol. And again, all of that has to do with the way estrogen is made in the liver and how it's recycled, how it's converted into androgens, how it's eliminated. There's a whole system that goes there, and any point in the system could go wrong. So we have to think about where is estrogen being produced, and it could be produced by the ovaries, it could be produced by fat cells, and it could also come endogenously or exogenously. Exogenously means we eat it. We're taking it in our diet, and that's adding more estrogen to our system. Then we have to think about where is it being metabolized? And all of it is being metabolized by the liver. The liver is going to activate and deactivate the estrogen. And the liver is also going to eliminate. So it's going to push that deactivated estrogen into the colon. And this is where we could have a whole discussion about the gallbladder and bile and all these things, because that's how we eliminate it. And then it dumps that deactivated estrogen into the gut. And then what happens after that? The gut now takes over. The gut can eliminate it. The gut can recycle it. And the gut can also transform it. So lots of things happening in the gut. So when we talk about the estrogen and estrogen balance, we have to look at those three areas to see, are you hitting all the areas correctly? And are you dealing with the problem? So if I'm not dealing with the gut and I'm only trying to take liver supplements, I'm not going to see any benefit. If I'm not cutting out the excessive estrogen that I'm eating in my diet and I'm not eliminating right, I'm still not going to see the effect that I'm trying to see. Because imagine if you're recycling estrogen. So today my body produces, and again, I'm just using a random figure just for illustrative purposes. So let's say I make 100 units of estrogen. That's what my estrogen level should be on a day like today. So I make these 100 units and my liver deactivates that 100 units and dumps it into the colon. My colon is recycling estrogen and reabsorbing that estrogen. So out of that 100, let's say 50% gets reabsorbed. So it means tomorrow I'm going to be dealing with the 100 units from tomorrow plus the 50 units that I recycled from yesterday. And then the day after that, it's going to be the same thing. It's going to be the 100 units from that day plus another 50% of the day before, and maybe 25% of the day before that. And then maybe I'll go through a shift. Maybe I will take a laxative, or maybe I'll eat more fiber, or maybe I take a liver tonic and I get a good flush. And then what happens? My estrogen plummets and I go crazy because now my estrogen has dropped. And what happens when estrogen drops? Affects the brain. I feel depressed. I feel sad. I don't know what's going on with me. Not because my estrogen levels are not normal. It's because my body sensed a sudden drop. Think of postpartum depression. That's why it happens. That sudden drop in estrogen is what triggers all this internal depression, like I said, sadness. Estrogen essentially makes us female. It gives us vitality. It makes us feel good and confident. You know, at different phases in our cycle, we'll realize certain points in our cycle, we want to socialize, we want to engage. And then there are other points in our cycle, listen, leave me alone in my space with a cup of tea and a good book. I don't need to see nobody. I don't need to talk to nobody. I can live like a hermit. I'm good with that. All that is the interplay of estrogen in our cycle. Okay, so that's how important estrogen is to literally every aspect of our life. And we have to remember that at every phase, every problem. I have a lot of women come in and say they have anxiety and they have depression. And a lot of the times it's not true anxiety, it's not true depression. It is a phase because the estrogen is out of check. All right. And I'm not saying that women don't get anxiety. I'm not saying women don't get depressed. But it's quite different to have a label of a major depressive disorder or generalized anxiety disorder versus me waking up one day and I'm anxious because I have an interview, or I'm anxious because, I have to travel. I'm anxious because I have a sick relative. That's completely different. That's not a generalized anxiety disorder. That's me having a scenario that has triggered this response, and that's a natural response in the body. We're meant to have all these symptoms: fear, guilt, sadness, depression. And the way I always think about it is that it should be like a breeze through the trees. Okay, so you're angry. Okay, fine, you're angry. What are you angry about? Deal with it. Let it pass. Understand your emotion. Understand where it's coming from. Deal with it, and then you move on. So I just want to differentiate that, between the two, that a lot of women sometimes want that label, and they like to say, okay, well, this is the issue. I have this diagnosis. But really and truly, can you really say that's the diagnosis if the estrogen is out of balance? And I'm saying sometimes we have to ask ourselves, is the estrogen in balance? And if that is in balance and you have those symptoms, then okay, yes, you have that diagnosis. But if it's not in balance, then I think you should take a minute and just re-examine it and see what's happening there. All right. Now, again, we're talking estrogen gives us that protection. And we're talking into that transition. We're now 40s, 50s, 60s. And what's going to start happening? Again, the estrogen, which gives us the vitality, gives us the confidence, makes us feel good. Estrogen starts going down as it's heading towards menopause. And now we start to lose the benefit that estrogen gives us. We love to see estrogen as being this negative thing because estrogen is feeding the fibroids. Estrogen is giving us PCOS and all these other things, but estrogen is wonderful. We need it. Okay. One of the benefits of estrogen is that it protects our heart. And it's because of what I said earlier, where we talked about estrogen and the fact that it has this impact on circulation. So if you think about it, how many people have heard stories of a young woman dropping down in the middle of nowhere with a heart attack? Never happens. Very, very rare. And if it does happen, it's usually because they had some genetic heart disorder or something like that. Never happens. How many men have you heard on the football field just drop down, heart attack, or exercising, or had a heart attack in the middle of the night? Why? Because estrogen supports the ability to have a whole second circulation. So I can have women walking around with blood counts of 9, blood counts of 6, blood counts of 10, and they're not well, but they're functioning. Okay? Men can't do that. Men can't do that. And if their blood count drops even a little bit, they feel it. They feel it. And so estrogen protects our heart. So if we look at the statistics, where we look at rates of heart attack, in men and women with age, what we see is that in the childbearing ages, women are at a baseline very, very low. Men are much higher. But then when we get into menopause, the two graphs meet. So then we have the incidence of heart attack being equivalent in both male and female populations. Why? We've lost the benefit that estrogen has given when we get into menopause. And because we don't have that benefit any longer, again, the incidence of issues to do with heart attack and heart failure start to become on par with men. So metabolic syndrome, high blood pressure, diabetes, all these things start to kick in when we start to get closer and closer to menopause, right? Now let's talk about fuel in the body. And this slide is just there for, general, because we all know this thing. We know about protein, we know about carbohydrates, fats and vitamins and minerals. We know all these things that are essential. Okay, we could spend days talking about nutrition and talking about why we need what we need and what we need and the amounts that we need. There's lots of debates. I mean, we could debate now in terms of how much water we should drink per day. Yeah. If I ask you all now, how much water should we drink on a daily basis? Anybody, just put it in the chat. How much water should we be drinking every day? I see 2 mils. I think it meant 2 liters. Anybody, how much water should we be drinking today? Half body weight in ounces of water. We agree with that? Yeah? That's a trick question because the answer to that really depends on the person, right? We have formulas, and the formulas are guidelines. So if I take my clone, let's say, and my clone lives in Alaska, would our requirements for water be the same? If I have a clone and my clone works in construction and I work a desk job um, in a supermarket, would our water and food intakes be the same? And now remember, this is my clone, so genetically we're the same, right? Right? If it's winter versus summer, are we going to have the same requirements for water or food or any macro or micronutrients? No. And that's the answer. Like, we love to take a lot of information, but what we have to be mindful of is really the guideline. Not everything is applicable, but what you want is your baseline. So that's why when you look at a lot of medical, like lab tests, you get that printout, you'll see some huge ranges. So like if we're talking about ferritin, and that's a whole conversation we could have about women and ferritin levels, right? So that's a talk for another time. You'll see it's a huge range. It says it's about 10 to about 200. That's a big range. How could a range that big be normal? Because it's based on the person. It's based on the age. It's based on so many other factors, okay? And you have to think about the person, think about who we're talking about to understand what is applicable and what may not be applicable. Okay, so when we're talking about nutrients, that's one of the things we always have to think about. So everybody has their opinion. Eat this, do that, but not all of it is applicable. We have to be careful because we're in an age where, we're talking about so many, it's an information overload. Everybody wants to tell you, this is what I did to fix this. This is what you should do to do this. But the reality is, not everything is applicable to everybody. So somebody heal their PCOS that way, it doesn't mean that's going to work for you. Somebody balance their hormones one particular way, it doesn't mean that's going to work for you. Okay, so everybody's different. So we have to remember all the information we get, we have to take it, we have to analyze it, and we have to see how it's applicable to us. Okay, one of the things, oh, my slide is frozen. Okay, good. So love to talk about the gut, partly because of the estrogen. But remember, one of the big things that I like to talk about when we talk about gut health is the fact that serotonin is actually made in the gut. And what's serotonin? Why is serotonin important? Serotonin is our happy hormone, right? It's one of our hormones that makes us feel good, makes us feel vibrant and alive, and that's made in the gut. And we just talked about estrogen and the impact estrogen has on the gut. So estrogen affects our brain, and estrogen affects our guts, and our gut affects our brain. Can we not see how estrogen can then have a double impact on our brain function, and why, women get labeled as emotional and too, in our heads, and we stick on things, and all these terms we use because we have so many things. This is one of the reasons why I take a big interest in female health. And I'm like, there's certain things that I cannot go to a male gynecologist for, because when I'm trying to explain to you that at certain points in my cycle, I just want to pick up a stick and beat somebody, which is not in my nature, but that's how I feel. Or at other points in my cycle, I feel like I want to lie down in a bed and rip out my womb because I just don't think it's worth it. I don't want to be in pain and cramps. A man can't understand that. I think it's challenging for men to put themselves in female shoes and understand what it means to be controlled by hormones, because that's what it is. Because sometimes as women, we do things that we know are irrational. We know it, but we still can't help it. We could, logically break it down and say, this is not why am I doing this? Why am I so upset over this little thing? Why is this bothering? You know what I mean? I can't take it no more. We've all, let's be honest, we have all had that experience. And we all know at specific points in our cycles, these specific things happen. And it's because we're being controlled by hormones to a big extent. And when we're out of balance, we just can't help it. We can't help it. And that's why sometimes describing these things, to a male, they're like, what are you talking about? That's small thing. Were you fussing over that for? That's nothing. And we're like storming inside, and and a big part of that is the hormonal balance. So for me, like mapping your cycle and understanding, there are phases in my cycle where I just don't answer certain people because I know at the point in my cycle that I'm in, that's not going to be a good conversation for me. So let me protect my peace a little bit. Yeah. And there's certain times in my cycle where I know I need to get work done because the drive, the passion, the energy is there. I'm sleeping good, I'm eating good, and I'm just going to get things done. You're in the zone. And that's the time where I want to push. And so sometimes we have to understand our cycles. And if we understand our cycles, like we can map out, and be so much more productive because we're working with our hormones, not against our hormones. There are times in your cycle where you just need to kick back. Like, I need a little break. I need a little reset moment here. And that's okay. That's perfectly okay. And if we understood that, this transitioning and this navigating will be so much easier, right? So remember that's serotonin. Sometimes when you feel a certain way, you have to ask yourself, is this my gut? Is this my brain? Is this my estrogen? Or is this a true emotional feeling that I'm feeling justified by the situation or scenario? Because sometimes it could be an interplay of multiple things that make us. The days you get up, you need to exercise, and you'll get up and go. And then there are days there's nothing that could move you out of that bed to get up and do anything. And you can't explain it. You just can't explain it. You know you should get up. You know you should do this, and you just cannot do it. Hormones, guys, the impact that hormones can have. Now, back to the gut, we're talking about the gut health and the fact that gut health is related to mental health, so depression and anxiety. Always be mindful of that. Let me just add a quick story because so I'm a big advocate because I do quite a bit of elderly care. And all is a big generalization, but the majority of elderly people are constipated. So one of the things I always do when I examine them, I ask about bowel movements, and I say, guys, give them a laxative. They need to flush. And a lot of it is because the muscle mass breaks down, the nerve function isn't great. So constipation is always a problem, especially if we're talking Parkinson's, Alzheimer's, and they have any sort of neuromuscular disorder. You're going to get constipation, right? That's just a fact. So I saw this lady and she had dementia, and it was full out dementia. Like she was walking up and down, she didn't sleep. She was angry, she was aggressive, she was ripping down curtains, ripping up books, slapping other patients. They wanted to call in a psych doctor. And I said, yeah, no problem. Let me see her, because she also had high blood pressure. Let me see her. So I saw her. Her feet were really swollen. She had lots of spider veins, varicose veins. So I know she had circulation problems. She had bad sinus, so her eyes were watery. She had these big bags under her eyes. Sinus and gut also related. So I already made the connection. Something's not right with her gut. Felt the belly, and the belly was high. So, a lot of women have that high, high belly. It's like right up on top. That upper part is just coming out like a shelf. Um, as opposed to like the lower hanging belly, which is more like a fluid thing. So I said to them, I said, guys, she is badly constipated. Let's give her something, because if I give her something and I make her poop a lot, not only can I make her poop, but I'm going to get rid of some of the fluid, right? We gave this lady one dose. I think I used Cascara, which is like a herbal laxative, right? It's more like a stool softener. And that woman pooped. And she pooped and she pooped to the point where they sent me this video, because they were like, Doc, this is not normal. Should we send her to hospital? I'm like, guys, it's just poop. Hydrate her properly and let's see what happens. I'll come and see her in about 2 to 3 days. I think I went to see her maybe on the fourth day, and I did not recognize that lady. She was sitting calmly in the chair. She was laughing. She was chatting. She gave me her whole life story. The feet went down, and I thought to myself, oh my goodness. She hadn't seen the side doctor, but she was sleeping. She was no longer aggressive. She was calm, and she was so much more accommodating. Like, just examining her the first time was such a challenge. And the second time I saw her, after she pooped all the poop she had to poop, she was like a whole different personality, a whole completely different personality. And she's not the only person that I've seen that with. I have seen a lot of aggressive elderly people where they become aggressive when they're constipated. And again, you have to remember with mental health, dementia, these things, sometimes you can't always communicate discomfort. So the discomfort comes across as aggression. So sometimes when we're irritable, you have to ask yourself, wait, maybe am I a little constipated? Did I go today enough? Did I hydrate enough today? Because sometimes that can also trigger the mental health issues. Because again, constipation, and we can have a whole discussion on constipation, like what is constipation? Because a lot of people will come and tell me they're not constipated. And then when I break it down and I analyze their pattern, I'm like, yeah, you are constipated. But when you're constipated, you're going to impact your mental health significantly. So we often have to remember that sometimes, like when we're not mentally where we should be in that right space, you have to think about your gut health and think, am I eating right? Am I going off right? Am I drinking? Am I hydrating right? Because all these things, sodium levels, hydration levels, constipation, bloating, all these things are affecting our mental health, guys. Okay? So ask ourselves that question. You're a little more irritable than usual. Did I go today? Did I go enough today? Maybe I need a little laxative to, clean the junk out, right? Mentally and physically. Fiber, of course, fiber is a big thing. People are talking about fiber maxing, how much fiber we need to take. And again, that's a trick question, because fiber is not good for everybody. I have a lot of people that I have on very low fiber because fiber makes them feel worse. Okay? They have a bad or very poor gut health, poor microbiome that can't break that fiber down. So fiber makes them feel more bloated, more constipated, just more uncomfortable, low appetite. Why? Because they can't handle the fiber. Okay. So people who do, for instance, carnivore diets, so people will say, okay, I had chronic rheumatoid arthritis and I had osteoarthritis, and I went and I did the carnivore diet and all my pain and inflammation went away. And part of the reason that works is because a carnivore diet is a very low fiber, almost no fiber at all, right? It's a very low fiber diet. And so for that person, that gets them where they need to be in terms of inflammatory response. Does it mean we should all be on a carnivore diet? No. Doesn't mean that at all. But for that person in that state, that helped them. If I put somebody else on a carnivore diet, they may have a heart attack in 3 months because that carnivore diet, if they can't process meat, if they can't digest that meat, if they can't break it down and their cholesterol goes sky high, that's plaque formation, that's atherosclerosis, that's liver issues, and they can have a heart attack and die. So again, when we're seeing all these things on, TikTok, we're in the information age, right? Information overload. Again, you have to process and understand what is happening, what it is saying, because not everything is applicable for everybody. So if you're inflamed, that's a whole different story. That's a layer on top of being female, on top of being pregnant, on top of being at a certain point in your cycle, on top of being a mother and stressed out at work. Again, layers. We have to think about this as layers, okay? Again, we're talking about fuel and the gut. We must talk about colon cancer. Why? Colon cancer is probably still the #1 cancer. And not just that, but it's the cancer that we're now seeing in younger and younger females, especially. And I have personal experience because one of my cousins actually, she was having symptoms of fibromyalgia. And they were quick to label and say, oh, it's just fibromyalgia, don't worry about it. And she had a cyst, oh, she had PCOS, so that's probably why, because she had metabolic syndrome and whatever. And she's all of a sudden started having gut symptoms. And, my sister, I have an older sister who's also a doctor. And so she and my sister are close in age, so, they talk. And so she was telling my sister said to her, no, you need to go do a colonoscopy. They did the colonoscopy and an ultrasound, and they realized that she had this mass on the ovary. And they said, oh, well, we know you have this history of cysts. Okay, so let's just, deal with that and remove it. They go in and they remove it, and they realize that it actually wasn't a cyst on her ovary. It was colon cancer. So she had colon cancer, and the colon became stuck to the ovary. So everybody was seeing this mass over the years thinking, oh, that's just ovarian cyst. But really, it was the colon. The mass was coming from the colon itself, and it stuck to the ovary. So she really had colon cancer, not ovarian cyst. And that can happen. Okay, scans can't always tell us. Sometimes you have to do surgery and go inside there and see it, because she had CT scans done. She had multiple ultrasounds, and every one of them pointed towards this thing being ovarian related. And it turns out it wasn't. It was colon. Okay, so for women, I love to talk about the colon when I'm talking about the ovaries, because that is what's sitting around the ovaries. And when we talk about the terrain and the environment that breeds cancer, because I always talk about cancer being an inflammatory response, you put a healthy cell in a pool of inflammation and inflammatory molecules and toxins. What's going to happen to that cell? It can't be healthy. No. So what's going to happen to that cell? It's going to morph. It's going to become a cancer cell, right? Because it's in an environment that does not generate health. It's an environment that doesn't help it multiply in the right way and be a healthy cell. So cancer always happens in a toxic, inflamed environment. And the most toxic area really for most people is the colon, because we don't poop enough. So it's because the concentration then of toxins and inflammation and undigested food and microbiome and parasites, all of that is sitting there. So you've created in this pelvis. And if you know the anatomy, the pelvis of men and women are just slightly different. But because in the woman, the pelvis has more, because we have the bladder to the front, we have the uterus to the middle, we have the rectum to the back, they're all touching. And let me just dive in and talk a little bit here, because I've had women come to me and they have UTIs that don't go away, and they keep getting treated and taking antibiotics. And I'd be like, wait, hold up. If we've done cultures and we've treated this antibiotic, you treated your UTI with this antibiotic, and you're still not seeing an improvement, what's going on here? And I have a lot of women that come in with UTIs or vaginal issues or discharges and smells and weird things. And a lot of it is coming from the rectum. Why? Because, guys, these things are microscopic bacteria. We can't see it with the naked eye. So they can translocate from one region to the next because the wall of the rectum is the back wall of the vagina. The front wall of the vagina is also very, very close and touching that wall of the ureter, so where the urine comes out. Okay, so bacteria can translocate from the inside through the walls of tissue, or it could also translocate from the outside. So we talk about hygiene, wiping front to back, not wiping back to front. There's a reason, taking care of babies and teaching young girls how to take care of themselves and hygiene. There's a reason we talk about that, right? Because you can transmit that bacteria from the gut all the way into it. So I see women who come up and they have E. coli and they have all these weird organisms found in stool in the vaginal swab that I did. Why? Again, because they can translocate. Okay, so remember that. So when we're talking about the pelvis, we're talking about ovary health, we're talking about the uterus. If the uterus is surrounded by a toxic, inflamed pool of stagnant blood and lymphatics, it can't be healthy. It can't be healthy. So women come and they have this story and they're like, oh, I have multiple miscarriages. Every time I get pregnant, I lose the baby and it happens within the first couple. Stress isn't healthy. The environment isn't healthy. They don't get pregnant at all, in some cases. Why? Right? Because that whole area, that pelvic area, is not healthy. It's not flowing. It's not draining properly. It's, like I said, stagnant, lots of inflammation because the inflammation is coming from the front, from the middle, from the back. They have done studies now that show that the uterus is not sterile. Who knew? Who knew? So we have a microbiome of the uterus as well that's there to protect us. Now we know that for the vaginal tract, but we always thought that it was limited to the vaginal tract. So we know we have certain organisms that help prevent us from having infections, right? But who knew, right, that the uterus itself has its own, microbiome that protects it and keeps inflammation down. That's pretty recent developments that they found, when they started testing, because at first they would have thought, okay, this is abnormal. But the more testing and testing that they've done, the more screening they've done, they've realized that no, we are an ecosystem, guys. I would love to think that I'm me and, the more the DNA that's here is mostly mine, but the reality is we have more foreign DNA in our bodies than we have our own DNA. We are in ourselves an ecosystem, right? And so the balance of our ecosystem is something that we have to control because we're the host, right? This is my party, this is my show, right? So I have to demand and keep things in line and keep all these organisms in check to manage inflammation. So if we're not doing that well, all these complications are going to happen. Yeah, just a little side note there. So colon cancer is something we need to think about. We need to be vigilant. For me personally, I think it's something we need to screen. If you talk to some people, they'll tell you I'm overly obsessed with pooping and asking people about if they poop and what their poops are like, because it really tells us a lot. And I think for women especially, because the reproductive system is so heavily dependent on that pelvis being in a good, non-inflamed state, that pooping is a really big part of that, right? And then we can talk about supplementation. I'm not going to delve too much into supplementation there, but I've just highlighted 3 things that I think are really, really important. Vitamin D, lots of research now on vitamin D, on fibroids, female health. They actually want to class vitamin D as a hormone now because they realize it does so much more than just a vitamin. And we think, okay, well, we're living in the Caribbean, so we get enough sun. So, our vitamin D levels are going to be, normal. But I can tell you, especially this last week, if I walk from my office to the grocery, and that's probably not even a block, I feel like I'm going to faint with a heat stroke. It's been that hot this last week or two. So to be fair, how much sun do we really get, right? Remember, we're also melanated, most of us. So melanin, which is of course the color of our skin, actually limits the amount of vitamin D we can produce. So when I started testing people, I have realized, right, that most of us are actually deficient in vitamin D. We're on the lower end. And why are we on the lower end? Because our sun is so intense. Okay, I always say Grenada has the hottest sun. Like I will go Grenada and get sunburned, and I'm not a person that burns. But a week in Grenada, I am sunburned, right? So all of us Caribbean islands, we have very intense sun, which means we don't get exposure, and the intensity of the sun means our body protects itself, and we're actually not making a huge amount of vitamin D. So it's really important to add the foods and things that will encourage vitamin D. A lot of people will say, oh, just go out in the sun a little bit and you'll make enough. But reality is, no, we don't. We don't. And, you could kind of see that because when I travel and I stay a month or two in, let's say, England or any one of those places, my complexion completely changes. In tutus, I'm shades lighter, not doing anything. And it's because my body at that point is starved for the sun and realizes I don't have to protect against this intense sun. And so my melanin starts to disappear. And so I come back to Trinidad and everybody's like, oh, look at fair so. It's because my body didn't need to protect itself when I was in the cold weather, and it automatically down-regulated it. So we have to be mindful that vitamin D, as simple as it sounds, that we might be getting enough. We need to make sure we're adding it in our diet as well, guys. We don't get enough. I've done my own levels and I was practically on the lower end of normal, which I personally think for my age, I shouldn't be on the lower end of normal. Again, why? Because once we're going through that phases of in as women, we really should have really good high levels of vitamin D. Why? Because remember, vitamin D and calcium are linked, estrogen and calcium are linked. So that cycle of vitamin D, calcium metabolism, all of that is linked together. So I shouldn't be on the lower end, okay? I should be on the middle to higher end because my body is still using a lot of estrogen, modulating my calcium. That's how you have a period. Literally, your period blood isn't supposed to clot because your body pushes a lot of calcium into it, and the calcium allows the blood to flow and not clot. So having lots of clots in your cycle is actually not normal. I grew up thinking, yeah, it was normal. It's normal to have pain and cramps until I solved the issue in my own self and realized, wait, hold up. 7-day period is not normal. Mm-mm. Big, large clots that have you bent over like this, not normal. Mm-mm. Mm-mm. Heavy flow where you have to be changing pads, 2, 3, 4 times. You're always messing up. Not normal. Mm-mm. Mm-mm. And that was my own personal story. And I could tell you how many other women have helped through that journey, realizing that, that's not normal. So vitamin D, big for me. I supplement and I try to get food sources as much as possible because that's really a big issue there. It's been linked to colon cancer, breast cancer, ovarian cancer, all of them, and low vitamin and fibroids as well. Fibroids have been linked to low vitamin D levels. Again, we're not sure of the science behind it, but it's not coincidence. Time and time again, when you check the levels, people with large fibroids, people with endometrial cysts, people with breast cancer, they all have low vitamin D levels. That's not coincidence. Omega-3s, the good fatty acids, we need them for the diet, for the hormonal balance. And then, of course, iron is a big one, right? Because why? Every month we're shedding blood, we're losing. So as women, we really need to keep those iron and ferritin levels in check. A lot of women are having issues because their ferritin levels are too low. Doctor will just do a CBC and say, oh, your blood count is okay. What is okay? I know personally for myself, if my blood count is 13, I'm exercising, I'm in the front of the group, I'm running, I'm good. But if my blood count is, 11.9, 12, I'm lagging behind. I'm not in the front of the group. I'm like in the back, really pushing and struggling to keep up. So there's an optimal level, and then there's a level that we say is normal, but may not be normal for us. So oftentimes I have to ask women and I tell women, that's the reason you need to have these checks done often. Because if I wasn't doing my checks often, um, I would not have known that 13 is my optimal. When I'm at 13, I feel good, but when I'm a little below that, I'm okay. I'm not sick, but I'm still not 100% and feeling that way that I really want to feel. So again, this links back a lot to diet. So we're losing blood every month. We have to replenish the blood. Where are we getting it from? Ferritin is the number one predictor of energy levels. So I can have somebody with a low blood count and a good ferritin and they feel fine. But if I have somebody with a normal blood count and a low ferritin, they'd feel tired, they feel weak, they feel drained, and they can't explain it because their blood count is normal. Okay? Ferritin is iron and protein bound together, and that's how it gets transported. It's important for your thyroid, absolutely critical for your thyroid. So a lot of women walking around with ferritins of 50, 60, 70. I tell people 100 is where your number needs to be, right? Because just to maintain your hair. So there is, let's say this is the hair follicle. This is the follicle and this is the strand of hair. This follicle, the ferritin is what binds it to the follicle, right? So a ferritin molecule is what's going to attach the hair strand to the actual hair follicle. So when our ferritin is low, the body starts to scavenge the ferritin. So what happens? These long strands of hair fall out, okay? So just to manage the hair, your ferritin should be about 70. And for good thyroid function, your ferritin should be about 90. So I tell people, you aim for 100. Okay, let's overshoot. So you want your ferritin to be about 100 so that you can balance the ups and downs that happen on a day-to-day basis. Because again, you have your cycle, you're going to get a dip. Okay, you're using a lot of thyroid hormone because you're stressed out, you're going to get a dip. So we don't want to be below. We kind of want to be always with a little bit of reserve that we can help balance our symptoms and our hormones. All right. So what's going to stop us from getting that iron in aside from diet? Gut health. How are we getting iron, right? So we have heme and we have non-heme iron. So of course, heme iron is from animal products, and then we have plant-based iron, right, which is a non-heme. We absorb way more of heme iron than we do non-heme iron. But what is absolutely critical for iron absorption, guys? Stomach acid. So all these women who come to me and they're taking antacids and they're on omeprazole and they're on all these Pantecta and all these other things because they say they have acid reflux. You've neutralized the acid in the stomach. What's going to happen to your iron absorption? So doctor taking these supplements, but my iron not going up, my ferritin not going up. I'm still feeling weak and tired. Them supplements don't work good for me. I just feel more sick when I take them because you have no stomach acid to break it down and digest it. So when you poop, you're pooping black because all the iron just went straight through you. None of it got absorbed. Yeah, none of it got absorbed. Right. Protein. How are we doing for time? Because I have not been looking at it.
We could take, well, yeah, I guess we can finish off a slide, and I know some questions are already coming in, but you keep the energy. Maybe 5 more
Okay, all
minutes.
right. So let me try to be quick then. So I think I only have about 3 more slides or 4 more slides. It's be wrapping up here. So I want to just touch on the protein because for me, this is a big deal for women. If it's one thing you walk away with today, is to start checking this. And so men have testosterone, and testosterone helps men keep their muscle. Women have very small amounts of testosterone. So when we're talking about muscle mass, when we're talking about muscle maintenance, we have to talk about what is going to help us as women maintain. So you go and you've worked out hard, you gain your muscle, you tone up, then what? How are you going to keep it? And the answer is we have to have adequate protein levels in order to maintain our muscle. So if I have a male clone of myself, okay, and both of us are eating the same diets, we're doing the same exercise, the man is going to build muscle faster than me, and he's also going to hold on to that muscle. So the minute we stop exercising, which it's the reality of life, the minute we stop exercising, who's going to get flabbier first? And the answer is going to be the woman, because estrogen will always predispose us to turn muscle and to have more fat percentage. Testosterone is going to, the man does nothing. So he just stops exercising, eating whatever. He is going to maintain more muscle. So I try to educate women about this, because a lot of times you think, oh, if I just go to the gym, I'll build muscle and keep it. No, 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 no. It doesn't work like that. By default, we don't hold the muscle that we have. Why? Muscle is metabolically expensive, right? So if it's expensive, from the minute a woman kind of goes back into not doing too much, immediately we start to break down that excessive, because remember, menstruation, hormonal balance, all these things for women are also metabolically expensive. So because we have so many other functions as a woman, you find as a man, they can hold on and build muscle very, very easily and maintain eating whatever they want. But we have to be a little bit more directed at that. So how do we do that? Stimulating the nerves, of course, which is your exercise and, stretching, flexibility, all those types of things, but also making sure we have adequate amounts of protein. What I actually wanted to do was for us to put this in and do a little quick check, right? Because I realized a lot of women don't do that. We think we're eating well. And I'll give you a little scenario. Um, I, I'll give you a little scenario. I had a patient who was complaining. She's menopausal, and she had all these pains. She had arthritis. She had a cyst removed. She was doing physiotherapy, and she wasn't well. So, she kept saying, oh, I'm in pain. I'm taking painkillers every day. What should I do? I need to do something. I don't feel well. So I sat her down. I said, okay, right. You're on the right treatment. You're doing this. You're doing this. Why are you not getting better? And you know what clued me in? She told me she feels worse after she does physio. And that was my red flag. Immediately, I knew it was a rebuilding issue, right? So I said to her, I said, okay, let's look at what you're eating. I eat well, I think, and she's actually a health conscious person. So, she had chicken and broccoli, she had her yogurt, she had I think for breakfast she had a little sandwich, and then she had some stuff. So I said, okay, good. I sat her down and I just put in what she ate that day into ChatGPT. Okay. And so we all know minimum requirements really should be about 0.8 to 1 gram per kg. So on average, most women, your minimum should be about 60. No woman, I should say, should be eating less than 60 grams of protein. And that's really important. Hot flashes. Hot flashes happen because you're not eating enough protein. Look it up. So anyway, she complained of all this pain, and I said to her, let's sit down and analyze. So we put in all the information into ChatGPT and just get a breakdown. And I challenge everybody here tonight to do that. Make a list of everything that you ate today and put it into ChatGPT and see what your protein intake. Again, we're not looking for exact, so you can estimate, okay? But put it in and see. And when we calculated hers, she was eating 26 grams of protein. She was on acid reflux medication, so she was taking omeprazole daily. And she has no gallbladder. So right off the bat, that tells me out of that 26 grams of protein, she's probably only absorbing maybe 70%, maybe less than 70%. Because again, gallbladder and acid, the stomach acid is really important to absorbing protein. So I said to her, I said, that's your problem. Your intake on a daily basis just to maintain, guys, is 65 grams, I think 66 grams when we worked out hers. If you are sick, if you are healing, if you are pregnant, if you are working on exercising, your value moves up closer to 2 grams per kilogram. Okay? So her maximum dose should have been closer to about 150, 160 grams of protein. So her minimum is 60, her maximum is about 160, right? And she was only eating 26. And out of that 26, like I said, I feel she's probably again maybe 18, 19 grams. Okay. She wasn't absorbing a whole lot of it. So imagine being that deficient. So you're deficient 40 plus grams of protein every single day for a month. Just think about what's going to happen to your muscles. Yes, we can recycle some protein. So I said to her, I said, listen, you need to restructure the diet. And that's what she did. And it was hard because she got into this habit of just not eating because she's not active and this and that and the other. But so she struggled. And what we did is I gradually increased her. So she was about 26 grams. I got her to move up to about 40 grams and then gradually got up to 60 grams and then gradually got up to, I think the max she did about 80 something grams, right? And she's still probably around that. But you know what? Her pain stopped. The back pain, the knee pain, the leg pain, all those pains that she was taking daily painkillers for stopped. She was under eating and starving herself for so long. She was literally breaking down her muscles doing regular day-to-day activities. And a lot of us, and that's why I have this slide here, a lot of us are not aware of what protein intake and protein amounts amount to. So I had this little question, and normally what I would do is I'd have somebody just tell us, you know what, and in real time, put in the data on AI and just see what your protein intake is like for the day. But I guess just because of time, we wouldn't do that today. Maybe another time. But put it in. Look at the numbers because a lot of us think we're hitting the mark and we are not. I remember putting in the numbers for myself and I'm preoccupied with that and I am way off many days. I'm not hitting the mark. So what I try to do is at least 2 or 3 times a week, I am pre-planning so that I hit my protein goal. It's not something that necessarily, like I said, I think you need to do every day. But if we're under eating chronically, guys, you cannot heal. You cannot repair, you cannot rebuild, you cannot heal if you are chronically under eating protein. Protein is the building block. And remember what I said, if you have gut issues, if you have acid reflux issues, if you have gallbladder issues, if you have any problems, if you're not chewing well, out of whatever protein you are eating, you're not absorbing the majority of it. So how do you want your body to repair, rebuild? How do you want the pain to stop? How do you want to build muscle if that's going to be a problem? All right. So I challenge everybody to work that and see what sorts of values you get, work out your target, and you try to get your target. Remember what I said? There's a range. So if you're trying to heal, if you're trying to build, you want to get closer to 2 grams per kg. If you just want to maintain, you want to go for about 0.8 to 1 gram per kg body weight, okay? And women, so more important, a lot of women in menopause who are having symptoms is because they're chronically under eating, okay? Chronic under eating is what gives a lot of people, as they go through the menopause, oh, I just get flabby, oh, I just get pain, oh, I just don't feel good. Again, that's the reason why, right? Okay, and so this was just to show you what sort of numbers we're looking at. A whole big chicken breast is about 31 grams. Greek yogurt is about 17 grams. I would say about 10 grams to 20 grams now you'll get in Greek yogurt. 2 large eggs, 12 grams. Movement, I'm not going to stay long on this. We know why we need to move. We need to train. We need to keep muscle mass. Muscle mass is the #1 predictor of morbidity. Now, mortality is death. Morbidity is your ability to live life and continue living life in a good way, being able to do all the activities of daily living. But if you have a morbidity, you can't do that. And if you look at elderly patients, those with the highest muscle mass are the ones that do better. I'm sure we all know somebody, they got sick, they went into the hospital, they were bedridden for a couple, maybe a week or 2, and then they came out and they couldn't walk again. They lost so much muscle mass in that short space of time that they could not support their body and walk again. Again, muscle is absolutely key to preventing long-term morbidity. So we need to work on the muscle long before we hit that age. Sleep. I could do a whole presentation on sleep, right? Sleep affects everything. It affects the hormones, it affects the gut, it affects our genetics, it affects metabolism. We burn fat when we sleep, not when we exercise. Not when we exercise. Basic metabolic rate, that increases when we sleep. The reset happens when we sleep, not while we're doing the activity. So if you are exercising and dieting and you're not sleeping, you are not getting any benefit. Okay, you're not getting any benefit. The number one, they did some studies and they were looking at Alzheimer's and Parkinson's and dementia generally. And what they found is that all the people who have these sort of neurodegenerative disorders, all of them had a history of constipation and insomnia. And that was happening up to a decade before the onset of the Alzheimer's and the dementia. What is that telling us? Sleep is when the brain gets to detox, where the brain gets to remove all the pathogens, all the toxins that are being produced from all the activity that's happening. And if that's not happening and you have toxins building up in the brain, guess what happens? You get dementia, you get neurodegenerative disorders, because that's what's going to build that up. So if I ask you guys, how many people you know have insomnia and constipation? And if I tell you that's going to be a predictor of who gets Alzheimer's, okay, numbers will be staggering. And that's why we're seeing so much more dementia right now. I'm seeing people who have full out dementia now in their 50s. That wasn't something that I saw before, but I have people in their 50s and 60s with full out dementia. Full out dementia, can't do anything. Okay, so sleep, guys, absolutely important. This is my slide that I wanted to spend time. Woman, you know, when we think about inner strength, I always say we have to talk about feminine energy. And feminine energy is warmth. Feminine energy is nurturing, it's comfort. Okay. And my theory on this whole thing is a lot of us are imbalanced, a lot of us are stressed because we keep trying to be or give something that we don't have. We can't give this feminine energy and this warmth and this nurturing and this comfort if we're not generating it within ourselves. Okay? So we're like this little furnace and we are producing this warmth and then we are giving this warmth out. You know, we always say like it takes a woman to take a house and make it into a home. Okay? Why? Because we bring that nurturing, we bring that warmth, we bring that feminine energy. And when we're cold, we're irritable, we're bloated, we're snapping, we're moody, that's not warmth. So what is happening? And it's always my theory that the reason we have so much of this happening is that you can't learn to be a feminine woman from a man. You have to learn that from a woman. You learn to be a woman from another woman. But we have lost our female community. We have lost that ability to sit with a group of women and just share and be open and honest and, you know, just have that confidence, that security. Oh, nobody's going to tell anybody my business. I'm not jealous. You know, I want to see my friends do well. We don't have that community that breeds that warmth into us. So if we don't have, you know, our own, you know, warmth generator, that spark. So, you know, you have coals in this furnace, you know, you could blow on it, mightn't get much. You could fan it, the flames will get a little, you know, higher. Or you could throw some gasoline and, you know, catch the whole thing on fire, right? And so the way I approach it is we have to find those activities that's going to generate the warmth within us. Because it's only when our furnace is shining bright, we can throw that warmth off into the whole room and the environment becomes warm. And I remember looking back as a child, you know, my dad could come home angry, or to be fair, my dad was never really an angry person, but didn't matter what mood my dad came in, it didn't really change the atmosphere so much. But if my mom was upset, listen, every man jack in that house was on their P's and Q's. It just totally changed the environment. And as women, we have to be mindful of that when we are not balanced, when we are not warm, when we're not comforting, we are affecting everybody else around us in a way more impactful way. Okay. And I think of it even more than just the physical. It's spiritual warmth. It is literally, physical warmth because, I'm sure we've all seen the meme with the guy and he has a pot of hot water and he's dipping his finger and the line says, preparing myself to take a bath with my wife because women love the saunas. We love to take the hot baths. We love a good cup of tea and to cozy up, especially when it's that time of month. We love warmth. And so a big part of what I always tell women is we need to generate that warmth. And that warmth is a physical warmth. So making sure your body is warm, your feet are warm, your core and your womb is warm. Not so avoiding cold drinks and especially in the nighttime, making sure your bed is nice and cozy, that type of physical warmth. And then of course the internal, emotional and spiritual warmth, being kind to other people, finding that activity that generates your furnace. Like, my sister likes to crochet and I look at her crocheting and I think to myself, that's the most stressful thing ever. Why would you do that? That doesn't bring warmth to me, but speaking to people, I love speaking to people. That's going to light my furnace. That's going to make me feel good and warm inside. It's going to help me, so that generates warmth to me. So I tell people every day, find your activity that's going to bring you your warmth because healing as a woman starts in your feminine energy. And it's a mental, it's a spiritual, it's a physical thing. And sometimes, okay, maybe I can't exercise today, but guess what? I could bring warmth in another way and help my body be just as healthy. You need people to help keep you accountable. You need people that you could support, that you could talk to, that you can ask for help. You need that. That is how we get warmth. So you're not an island unto yourself. And if you're not getting warmth as women together in a collective community, you're going to be in trouble. If you're waiting on men to give you that warmth you're looking for, you're in trouble. And I think that is a part of why, as women, we've strayed from the path a little bit, right? We need to find what helps us. And this, I think, is my last slide here. Just, I wouldn't be a doctor and give a good presentation if I didn't talk about some of these things, because these things are the things that really, we need to be aware of. Cancer is a big deal right now. It was always a big deal, but it's really prevalent now. And the things that we really advocating for is screening for specific things, and the cervical cancer, the breast cancer, the colon cancer things. Guys, see a doctor, get a good GP, do the screening, okay? Don't be in denial. Have the checkup done, have the blood test done. A lot of people wait till too late, and when you wait till too late, there's nothing we can do. Okay, so you want to have the screening done appropriately. In the younger years, remember, cervical cancer is a big thing. Sort of in the middle, it's breast cancer, especially if you have a family history. And then you want to screen for the colon cancer. So yes, you're working on your health, you're working on your stuff, but you still want to have that. So again, for me, just do one thing. One decision every single day that puts you in alignment with your healthy self. I'm going to drink more water today. I'm going to be kind and warm and not snap at anybody today. I'm going to exercise today. I'm going to do my blood test today. Whatever it is, you choose your thing today that's going to help keep you on your wellness journey, keep you on your wellness path, right? So I know we said we had some questions. So let's see how many we could get answered.
All right.
Do you want to ask the questions and I'll just answer? Or...
I think you may have to come back for this Q&A, but we will take a few.
let's do 2 or 3 questions. Let's just do 2 or 3.
Right. So so ladies, y'all could drop your questions in there. I'm going to start off with some. Now, you documented a lot about the hormone estrogen, right? I heard a lot about estrogen coming up in the presentation.
Mhm.
I'm sure a lot of ladies out there is wondering, how do I know that I have healthy levels of estrogen? Is there a way I can test? And if so, what is the test?
Right. So you can test your levels, and the levels would be a blood test. However, the new research is showing that salivary estrogen is actually a better indicator of the activity. Because understand, you can have normal levels of estrogen in the blood, it doesn't mean it's active. And then it also doesn't explain. Remember, I touched on you can have other compounds that act as estrogen, even though they're not estrogen. So you could have the zearalenone, you could have the BPA, you could have lots of things that binds the estrogen receptors. So I could have somebody with a normal estrogen level, but they're displaying signs of estrogen dominance. All right. So you still can't use that as the whole story. You still kind of have to work your way around it and figure out what it is. But saliva and blood will be the two ways that we check estrogen levels.
Okay, thanks. And then I see Kevor Thomas asking, how do we improve our iron absorption?
So stomach acid for sure. Heme iron. So remember I said non-heme, so plant-based iron, we only absorb maybe 12 to 15% of the iron in it. So if it has 100 milligrams of iron, we only get in 10 to 15%. If you're looking at heme, which is the animal sources of iron, you'll absorb maybe 25 to 35%. So if it's 100 grams of animal iron, you'll get about 35%. You need good stomach acid to digest protein to release the iron. So having a good stomach acid, so taking it with vitamin C to absorb the iron. And for people, so like myself included, I tend to take digestive enzymes, or I would do, and this is only for people who have poor or low stomach acid. Huh? You know, some people would do a little apple cider vinegar in water before meals to help add a little acid. Or you could take, like I said, a digestive enzyme that has some acid in it to help you break down that protein. So if your gut system is good and you don't have any problems, then you absorb your iron very well. But if you have issues with iron and you're excreting it, the two things I would say, make sure your stomach acid is good. So either take a digestive enzyme or take a little apple cider vinegar or um, whatever else you could use to acidify the stomach a little bit. Or you could use and sorry, not or, and you should use some vitamin C, right? So vitamin C would be a good idea.
All right, thanks a lot. Now, the last thing I'll put there, because waiting for some more questions to come in, but I'll just put it here. Now, you mentioned a lot again about the estrogen coming up, and I heard the talk of detoxification coming up. Now, for the average person, the average woman, being bombarded each day with different toxins from the clothes they wear, the food they eat, the air they breathe, all of these stuff, even the birth controls, and we might have to come back and talk about those. How can a person help to regulate the estrogen buildup, or how should a person go about detoxing to help to regulate and make sure that the estrogen is passing through in a safe way?
Okay, good. That's a fantastic question. So the way I think about it is a barrel. Okay, so the toxins are coming in on the top and open end of the barrel. And on the bottom of the barrel, we just have a little hole. And that little hole is how it drains. So we want to always keep in mind that it's about balance. So if we have a lot of toxins coming in, we want to make a bigger hole or multiple holes so that the toxins are draining out just as fast. So remember, I broke it down. We have to look at where the estrogen is coming from, how is it being metabolized, and how is it being excreted. So when we look at where it's coming from, that's your diet, that's your environment, that's the BPA, that's your body making estrogen, so that's your fat cells. Then we have the liver. So of course, supporting. So aside from changing your diet, losing weight, those things will help the estrogen coming in. For liver support, you can use turmeric is great for liver support, milk thistle, dandelion, um, all those would be really good for supporting the liver to help the liver get rid of the estrogen. And then on the other end would be the gut health. So something as simple, you know what's the basic thing that I would use? A grated carrot. You just wash the carrots, so raw carrots, you wash it, you don't peel it because most of the fiber actually is on the outside. And you grate a carrot and you try to have um if it's a small carrot, a whole carrot. If it's a really big carrot, then half a carrot. And for women to do that every day that they have their period. So from the day before your period through your period, you have this grated carrot. Because what's that's going to do, it the fiber in the carrot plus the vitamin A, because the vitamin A helps support liver detox, but that fiber can trap the estrogen in the gut itself and help you eliminate it. So I can't remember the science of why the carrots worked better than the other fiber supplements, but carrots, ground flaxseed, um, were the two big ones that really help to balance the estrogen from the gut perspective, right? A good probiotic as well, because again, if you have the microbiome in the gut being off, that's going to shift. So a good probiotic would be the other thing that would be helpful in terms of balancing that. And then I would probably, if you want to add other layers, you could start, like I said, exercising, sauna. So sweating would be another way that you could also do that. And even, Epsom salts and soaking the feet in Epsom salts, because the magnesium and the relaxation, because it helps with the circulation part of the estrogen, you find that also helps modulate the excessive estrogen. So again, think of those three areas where you're getting it: your diet, liver support, and then the gut health. If you think about those three and you have all three avenues supporting the removal or the lowering of the estrogen levels, you can get there very, very easily, simply.
Perfect, perfect. I see one more question came in, so I'll take it as the last. I'm going to read it. It says, my hemoglobin has fallen from 13 to 11.9 over the past 2 years. Should that downward trend prompt ferritin and iron studies, or is that studies or supplements, or is it still considered normal?
Yeah, I would definitely check it. So I think even a normal hemoglobin, you should still always check your ferritin, especially as you're getting older. So in a younger woman, let's say in their 20s, I'm not going to be as concerned. But once you're into your 30s, 40s, 50s, 60s, 70s, every time I do a blood count, I will also add a ferritin. If I see a low ferritin, I'm going to add all the other iron studies. So like total iron binding capacity, the sex globulin binding hormones, and all those other fancy ones. But I would do ferritin as a basic test. I always would check the ferritin. And why? The ferritin is going to point me in the direction of the thyroid. So if I see somebody even with a normal blood count and their ferritin is low, I'm going to know I have to check the thyroid, because the thyroid is going to be suffering with the low ferritin as well, right? So yes, you should do it. Yes, any fall in those numbers is something that you should pay attention to. Again, it could be pointing to other more significant things. It could be a poor diet. It could be you not absorbing the iron well. It could be a gut inflammation issue or a liver processing issue. So a lot of things could explain why you fell in the first place, because the body's goal is homeostasis, where you're maintaining your levels consistently. So yes, you should have some further testing done to see that it is normal, and then supplement correctly to make sure it's going up. If it's going up, then no further testing is required, because supplementation was able to fix that. But if you're supplementing and you're still trending downward, it's an indication that you have to dig a little bit deeper.
All right, thanks a lot, Dr. Diane. Now, I know we went there, but listen, the whole team was interested. It's the highest I've ever seen. We got up to 60 persons on here live tonight, and it goes to show the volume of excellence that you did in your presentation. So, Dr. Diane, with that being said, I want to thank you on behalf of the Evesham Estate Church, especially First Elder Maxon, for taking time out of a busy schedule and spending almost 2 hours here with us. Now, it goes without saying, ladies, that we have to bring back Dr. Diane for the Q&A segment, right?
Yes, we'll have to.
Because we still have to get some of these questions answered. And I think I would like to hear a little bit more on the specific conditions, especially like the but let's still change it now to PMOS and the fibroids and how that whole hormonal thing plays into that, and then what specific steps they can take and so forth. So this is the first of many to come. You will let me know when you're available again so that we can definitely bring you on this platform. And if you're watching the chat, the whole audience is loving you and they have really enjoyed it. In fact, my wife sent me a message. She said, this woman really knows what she's talking about. Right? So I guess you explain things to her in a way I could never have because I've never gone through it. So I really appreciate that. Thank you again so much for coming on. And thank you all for participating. We're going to rebroadcast this again tomorrow night at 7:30. So for those of you who missed it or came in late and want to pick up the second part, then you'll be able to pick it up there. Dr. Dian, any closing words before we go?
To me, the message really is, as women, we need to take care of ourselves. That's my big thing. And I've had my own personal journey in understanding that, and that as much knowledge as I have and I know, I am still on this journey along with everybody else to be better, at what we do, at, who we are. And there's so many things that are involved with this. And, my goal here really is guidance. I think all the information is there. Anything I've said, you could check for yourself. But the only difference is, like, I can spill this information out, at the drop of a hat, whereas, somebody else has to put the pieces together. So really the goal is that I hope in the general sense of the presentation that I've made, that I've left little, tidbits that will get somebody just thinking, hey, I need to do this. Hey, I need to do this a little different. Hey, I need to look up at this. That's the goal here, that I think if we're all a little bit more mindful about the day-to-day things that involve our health, we will get better every day. And for me, it's all about community. I love community. Communities where we build each other. I can't build myself alone, but if I have people building me while listen, there's nowhere or nothing we cannot do. And for women, the stress, we love to be everything to everybody. And there's sometimes we need to be everything to ourselves. And we need to get ourselves back into alignment. We need, as women, collectively, because I personally think society's deterioration is because of women, because we are the foundation. We bring everybody into the world. Yes, we raise the children. Yes, we have support from men. I'm not saying no, I'm not saying that, but as we get stronger as women, society is going to get better. And I think that's where it starts. So let's build better communities. Let's be stronger. Let's take care of ourselves and let's move forward. So I'm happy to come back. If we could keep a list of the questions, we could go back. Maybe we'll just have a session with the Q&As just to make up, because I really actually wanted to do the Q&A and answer some questions. But, I'll leave it open to whatever you all want to talk about. I'm happy to oblige.
No problem. So we could probably start the next session that we do with the Q&A
Yeah.
from this
And
last
yeah.
one, and then
Yeah.
you jump into the new one. All right, so that being said, let us show Dr. Dian some love in the chats. Use your heart emojis, whatever you're using. Drop them in the chats right there. They are coming. The screen is lighting up now. So the ladies, right, love it, love it, love it, love it. Thank you all so much. Thank you again, Dr. Dian, for being here. And we're just going to close it off with a word of prayer, and then we'll be on our merry way. So just bow your heads with me. Dear Father in heaven, we just want to thank you, Lord, for this timely information. We want to thank you, Lord, that you have sent your servant here to speak to the ladies, have gone through the experience, understand exactly she's speaking from a place of being there. And so we want to thank you, Lord, that she was able to connect with the audience. We ask, Lord, that some information that was said tonight will resonate with each and every person so that they can start their journey to wellness. Again, we just want to thank you, Lord, for this platform. We ask that you may bless it, multiply it, expand our territory so that we can reach more women and men around the world. In Jesus' name, amen. All right, so good night, everyone. And I just want to say a special shout out to all the men that came on here tonight. It's good to see that, I'm not the only one who wants to learn how to understand my woman so that I can, better help as she goes through that journey. So I saw a lot of gentlemen on here tonight. So Dr. Dian, I think that must be noted that even the men who are here listening tonight, and I trust that they would have taken away some information that can help them become better husbands, better spouses moving forward. All right, so take care. Have yourselves a great night. Thanks again. The entire Evesham Church SD administration thanks you. I know Brother Max has personally told me to thank you. So we just want to say that special thanks to you. All right, take care and have a blessed night.